right, let's just go through it together to save some time. So for vitamins in general, we're not going to be straight up nutritionists, dietitians. We're not doing that. We're PAs, okay? So we have to recognize what presentations come with deficiencies. We're going to keep it very simple. We're not going into the weeds of all this stuff. It's just, what do they usually put on vignettes that make us pick this vitamin versus the other? And in most cases, most of the Q banks that I've seen, when they give you a deficiency, they usually put all the answer choices as vitamins, because you can imagine, like, if you have a niacin deficiency, that you might like all these random symptoms, it would be really hard to say, oh, that's niacin, when you have all these other illnesses that cause similar stuff. So usually it's pretty straightforward. For my test, as long as you understand what the symptoms are, the most classic symptoms, you will get it right on my test. All right, deal? All right, role of this vitamin to maintain healthy epithelial structure, as well as with the visual system. Which one's that? Vitamin A. Very good. Which of the following not a fat soluble vitamin? How do y'all remember this? The naked fat guy, or the addict, the cat in the attic. Okay, whichever one you do, just remember A, D, E, K are fat soluble. So which one is not fat soluble? B and C are not fat soluble. Okay. Blank is the clinical syndrome resulting from thiamine deficiencies seen in the US most commonly in blank. Okay. Berry alcoholics. I would say of the fat soluble vitamins, I mean, they're all testable, but the ones we need to focus on a little more are berry and pellagra. We need to look at those a little more closely. Okay. Which of the following is not one of the 4 Ds of niacin deficiency? Which one is not? Dizziness, right? So we do get dermatitis. We can get diarrhea, dementia, and death. And when we see these in vignettes, the vignette's not going to say, the patient comes in with dermatitis, diarrhea, and dementia. What do they have? It's going to put it in story form. You know, the patient came from this country. He only ate rice for a long time, and now he has a sunburn looking rash, and he has occasional loose stools. It's going to tell you the story, and from there you've got to pick the pieces out and say, oh, that's pellagra. Okay, make sense? All of the following manifestations of marasmus except. Okay, so there, for these, again, I don't see questions very often on this, but when they do, it's a very superficial question. Just, can you differentiate between marasmus and kwashiorkor? Okay, and when I think of marasmus, I don't know if y'all ever watched South Park as kids. When I was little, there was a character called Starvin' Marvin. Have you ever heard of him before? Yeah, he's from South Park. Hold on, let me show you a picture. So Starvin' Marvin, I know it's not politically correct. Let's just get past that. Okay. Starvin' Marvin looks to me like he has marasmus. He's very wasted. You can see his ribs. He's a scaphoid abdomen. And so I remember that Marvin, in my head, I remember Marvin starts with an M and he looks really wasted. So that's marasmus. That's how I remember it. That's why I'm showing you the picture. Okay. So they don't have a lot of swelling. They don't have protuberant abdomens. They do have loss of subcutaneous fat. They have prominent ribs. They have a voracious appetite, and they don't have a fatty liver. So, edema. They don't have edema. Okay. And we'll go through the differences between the two, I think, in a little bit, but essentially just have to compare and contrast them. That it's really that easy. Okay. All right. Let's do our cases quickly. All right, so I tried to put characters, if you like Disney characters, I tried to put characters that tie to the things so you can remember them better. So if it helps you, great. If it doesn't, then maybe you need to have Disney binge weekend after your test or something. It'll make more sense if you know a little bit about the characters, okay? So Dash, he's a 2-year-old with poor development, as well as vomiting, irritability, and a skin rash. And the reason why I chose Dash, why do y'all think I chose him? Well, not because he's fast, because he's very fair skinned and he has very light colored hair. That's why I chose him. Yeah. So he's 2-year-old. He's coming into the health clinic in Mexico because of poor development, as well as vomiting, irritability, skin rash. And he has a strange mousy, either they use mousy or musty, either one, they use them interchangeably, odor. And he has eczema-like rash, hyperreflexive, increased muscle tone, very fair skin complexion compared to the rest of his family. Okay. So this is not something that we see often because we screen for it, but we do live just in the backyard of a third world country. So there is a chance that someone could slip through the cracks and end up in our clinic looking like this. Okay. So what information or labs are you like? Let's keep it really simple for PKU. Very, very simple. So what information or labs would you get on this patient? So we should have done a newborn screen on this patient, right? We should have done a newborn screen. For the newborn screen, you get it done. You do a heel stick and you get blood, you send it off for multiple different abnormalities, including PKU at birth, and then another set at a week, okay? And you reassess for it. So in this case, if we were going to diagnose this patient later on in life, what we're looking for is elevated serum phenylalanine, okay? That's what we're looking for, and that's the patho behind PKU. What's the most likely diagnosis? I think it's easy when you read this vignette. The musty odor, the developmental delay, the fair skin, the eczematous-like rash, all of that's pointing you towards PKU. Like we mentioned, the main one that I see is the failure to thrive, can't talk. The developmental delay. They're just not going to be following those milestones and the curves like you would normally expect. And the appropriate treatment. What do we treat these patients with? Very simple. Well, not simple, but diet correction. So we're going to inform the parents the different foods that they have to stay away from, as well as synthetic sugars. Okay. I don't expect you to know all the different foods or anything. I just want you to know that the treatment is diet modification. Okay. And it's pretty hard. I mean, there's a lot of foods that contain phenylalanine, so it is a lifelong struggle for them, but they can live normal lives. Relative normal, meaning that they can grow old and they can have fairly normal lives besides changing their diet. Okay. Sorry? There's no cure for it. No, there's no. They have to just modify their diet for the rest of the life. Crazy, right? Like we said, we should do screening. It's at birth, and then 2 weeks they do screening for this. So most of the cases get caught. It also has a genetic component to it. Okay. All right, that's all you need to know about PKU. Right now it's easy. When you see it on my test, you're gonna be like, oh, that's so easy, it's PKU. Okay. But once a year from now, year and a half, when you take your pens, it's not as easy because it's kind of random, right? Like skin, a little fair skin, but just look for those clues, those buzzwords, and you'll be fine on any test. Okay. All right. So case 2, routine checkup. She's 19, and she reports lacking energy. Who doesn't report lacking energy? I feel like she hasn't been able to kind of carry her load. She also has a smooth, sore tongue. She's become a strict vegan over the past 5 years, so that's important information. She has decreased vibration sensation and proprioception on exam, and she also has a twitch. And on her lab, you notice a macrocytic, anemia. Okay, bless you. So what did y'all think? This is a throwback because y'all covered this already back in your very first module. If Dr. A was here, she'd be ready to if y'all don't get it, right? So what is this? More than likely it's B12 deficiency, right? Why B12 and not folate if it's a macrocytic? Why? So yes, the CNS manifestations, as well as what food is she eliminating? She's eliminating proteins from her diet, right? So that is what another reason why I'm thinking B12 more than anything. Okay, I'm not going to test you on B12 folate, but I thought it'd be a good opportunity to refresh ourselves. Okay. You already knew that? That was easy?
Yeah, it's like
Dang it.
the only one that I could have banked on.
Well, maybe I already submitted my test. I was like, I could have given you an easy one, but. So yeah, just for the pants, make sure that you remember the difference between B12 and folate, because they will put both of them as answer choices on the test, okay? What I think of for folic acid more than anything is the pregnant mom, supplementing for the pregnant mom to prevent neural tube defects. And folate and prenatal vitamins, they actually recommend moms start taking before they even try to get pregnant. So to keep those levels up, okay? Very good. All right, so I have a quick Nearpod stop here. All right. Take a second. These are real questions from QBanks to give you kind of an idea of how they would test or what they would look like. By the way, I meant to ask for pyloric stenosis. They say that it's more often male and more often the firstborn. Did anybody look up why? I meant to look it up and I forgot. So if you find out, if they figured out why it usually affects the firstborn, let me know. I'm curious. All right, so this is a real case, a real vignette that I got from a QBank. When you read it, can you tell that it is PKU? Yeah, pretty easy, right? And so the control, dietary control, that's easy, right? That is a real case. So this is how familiar you have to be with it, okay? Here's another one. All right. So if you haven't noticed after watching my Panopto or reading about these problems, a lot of them stem, it's especially here where we have a decent amount of food available, right? With alcoholism. Okay, alcoholics care more about drinking than eating. They are very deficient across the board. And so we'll see a lot of vignettes with vitamin deficiencies of an alcoholic patient. Okay, and they can get a lot of different vitamin deficiencies. So just keep that in mind. Other people that we see that present, especially with fat soluble vitamin deficiencies, are people with malabsorption. So like celiac disease, untreated celiac disease, cystic fibrosis, pancreatic, chronic pancreatitis, those kind of things, okay? Malabsorption. Let's see. Macrocytic cells. What in this made you think folic acid versus B12? What is the one line that made you think one versus the other? Yeah, neural evaluation is unremarkable. So sometimes you get a little bit of neuro stuff, but it's mostly B12 that has the neural, okay? So this should be folic acid, okay? All right, let's do the next case. We're doing great. Thank you for your participation and your focus. I know it's hard to focus for this long at a time. So this one, we have a 48-year-old homeless man brought to the ER, confusion and gait instability, okay? I don't know about you, but alcoholic tend to be confused and have gait instability regardless of their vitamin deficiencies, but there are going to be some things we see here that are going to clue us in, right? So he has an alcohol use problem. He's had multiple hospitalizations for alcohol, so he's a frequent flyer in the ER. He drinks a lot and he appears inattentive. He has nystagmus. And he has his gaits kind of slow and wide based, kind of like if he was, like that, like, like zombie-esque. And when he's experiencing tingling and burning in his legs, he can't remember what his name is, but he keeps talking about how he's able to see the future. So he's kind of confused, right? So what would you say is the most likely diagnosis, given that we're talking about vitamin deficiencies? What would you say in his case? Okay, beriberi, is that what you said? So beriberi is the clinical manifestation, but what is the deficiency? Thiamine. Okay, so thiamine is which vitamin? B1. So he's an alcoholic, don't B1, right? Okay, don't B1. Okay.
Why is this one beriberi and not one?
It is. So beriberi, there's wet beriberi and dry beriberi. Okay. Wet beriberi is more of like a CHF. I think of it like a CHF picture. So you get edema, kind of a heart failure thing. So that's wet beriberi. Dry beriberi can be subclassified as Wernicke-Korsakoff. Okay, Wernicke, like we're gonna see it. This is more of a Wernicke's thing, and then the Korsakoff has to do with the amnesia and stuff. So he might have components of both. I'll show you right now how I remember Wernicke's versus Korsakoff's. I usually see them kind of lump it together as Wernicke-Korsakoff, but if we're going to get down to the nitty gritty details, I'll tell you how I remember the difference.
Would you say like beriberi is like more umbrella?
Yeah, beriberi is an umbrella term.
Okay.
And so this would be dry beriberi / Wernicke, maybe Korsakoff's coming, something like that. Okay, make sense? All right, so most likely diagnosis, we said B1 or thiamine. I would like for you for the B's to be familiar with the other, like thiamine / B1. Be familiar with both. For the fat solubles, just the ADEK is fine, okay? What clinical manifestations are common? Like we talked about, beriberi, so dry or wet. And then, so for Wernicke's encephalopathy, you usually see nystagmus and ataxia, okay, not be able to walk very well. And then the Korsakoff comes in when you have more of the confabulation and the retrograde and anterior grade amnesia, okay. So this is how I was taught to remember it. Coat rack, okay. So coat would be Wernicke's confusion, nystagmus and ataxia, okay. Then for Korsakoff, I think of rack, so retrograde, anterior grade, and confabulation. So these patients are really interesting when you see them present because they come in, they're kind of, I don't know about how many alcoholics you've seen like coming into the ER, but they're a little drunk, okay? So that doesn't help everything, but they have nystagmus. You can't fake that, right? So they have nystagmus, they have this weird ataxia, and they're a little out of it. And then to fill in the gaps, when they have the Korsakoff, they start just making stuff up. They just, I mean, you can have, they'll tell you this elaborate story, kind of crazy, like, oh, it's just a drunk talking. And then the family members right there, if they have them, because a lot of times these patients become estranged from their families. But if the family member's there, they'll tell you that none of that's true, but they make it up. It's kind of cool. I mean, not cool, but interesting. So what other pathologies are commonly seen with this vitamin deficiency? Well, we talked about dry beriberi and wet beriberi. You should be familiar with those two. Okay, cool. All right, next one. We have a motor. This girl comes in after an MVC. Okay, so she comes in after an accident. Okay, and she said she was trying to drive in the evening time. She had trouble seeing. And she went off the road and she's having trouble with night vision for several months. And her sense of hearing has improved because of this. She also noticed dryness in both of her eyes and her skin. And she has a history of celiac disease, but she has not been sticking to her gluten-free diet. So what did you think after reading this that she has? Vitamin A deficiency, right? So we see problems with malabsorption, like we said, celiac disease. If you're not absorbing fats, then you're also not absorbing fat-soluble vitamins. So yes, vitamin A, we're going to look for specifically night vision disturbance, okay? And then dry skin, because it's the vitamin that helps with keratinization, so you can have problems like that. So almost every case I've ever seen, I would probably say every case I've ever seen that talks about vitamin A deficiency talks about night blindness. Okay, very good. All right, that's it. Easy case, right? All right, I think, is this the last one? Maybe there's one more. Okay, well, they're quick anyway. We're getting through them quickly. So this guy has a rash. That's what he's presenting with. She said that he's been forgetful lately. And he has a rash on his arms, neck, legs. Episodes of diarrhea. He hasn't really been eating much other than these corn arepas. And he seems a little bit confused, unable to recall what's going on. He has a sunburn-like rash on his hands, neck, face, and legs. So what did y'all think about when you read this one? Okay, also known as? Pellagra. Okay, pellagra. So niacin deficiency, very good. When you read this on your own, did it pop out at you pretty quickly, pretty easily? Good, it should. Okay. So the D's, so diarrhea, dermatitis, dementia, and then death obviously is a late finding. Not really a finding, but we found him dead of pellagra. Very good. That's it. That's all I want you to do is be able to recognize in a vignette, right? You don't remember him from the movie? He's the one that keeps getting stung by bees. Anyways. Yeah, I need to rewatch Encanto. Oh yeah, I forgot. This is the last one. He's so cute, isn't he?
Yeah.
It's precious. So he comes in due to poor growth, weakness, and abnormal gait. Aren't those legs like perfect for him? They look like literally like they belong on his body. Okay, so he's 5 years old. He has poor growth, weakness, abnormal gait. He became, I've not seen this often, but kids can choose what they like to eat. My son really doesn't like to eat a lot of like meat stuff. He eats chicken, but not meat that much. But vegan, he loves animals, and he spends a lot of time in his room. He doesn't go outside very often. I would too if I had a room like his, right? Okay, and then when you do exam, you see bowing of his legs, and laboratory testing shows decreased serum calcium and phosphate levels. So you see those legs, they're bent, they're bowed. So what is the most likely diagnosis? I think we can tell it is rickets. Very good. And that is a deficiency of which vitamin? Vitamin D. Very good. What else about Antonio do we see that would make him more likely to have rickets? His dark skin, correct. So the darker the skin, the less you absorb vitamin D from the sun, and the more likely that you're going to develop. So most patients that have rickets are dark-skinned individuals. Crazy, right? So what is the adult version of rickets? Osteomalacia. Good. And you will cover this rickets specifically again and its manifestations in the MSK module. Cool. Very good. Super easy. That's all I want you to do. Don't get overwhelmed by the vitamins. If you know this chart right here, you'll be excellent for the test. Okay. Are we good?
Yeah.
All right. We have one more activity here. Let's go do it. Okay. Yeah. Let's do this one. Matching. Ready? Go. All right. Time's up. Let's do it together. All right, so scurvy / poor wound healing. What's that one? Wasn't that interesting about pirates and all that kind of stuff? Interesting. But did y'all ever play Pirates when you were little? I know like we used to play. You like Pirates of the Caribbean? I know when I was little, I used to play pirate and I would say like, oh, scurvy. I would say it when I was a kid. I didn't know what the heck it meant, but now I do. All right, let's see. Vitamin A, I'm going to look for blindness, some sort of night blindness, right? Where is it? Right here. All right, let's see. Pellagra is going to be B3 niacin. Berry is going to be B1 thiamine. Let's see. We're bleeding, elevated PT is going to be vitamin. Another throwback to Dr. A's module. Very good. Rickets is going to be vitamin D. Okay. Let's see. Megaloblastic anemia with neural tube defects is going to be folate. Megaloblastic anemia, seizures, dementia, neural findings, B12. And then that one is of exclusion. We don't often test on vitamin E, but it can cause some hemolytic anemia and degenerative changes. So I've never seen them ask about it on any test question. So, but I'd still be like that much familiar with it. Okay. All right. Here's another chart. I mean, I'm sure you have overwhelming amount of information. As long as you pick a chart, stick to it, know what the deficiency findings are, you'll be good for the test. Okay. Let's see. Okay, time to climb. All right. All right, can we go through it real quick? Okay. So this photo, you see protuberant bellies. They are cute. It pulls at your heartstrings, right? Like those commercials you see, In the middle of the night, it's like donate
Oh,
money.
yeah, that one.
That one in the dog commercial, the Sarah McLachlan songs, right? Okay, so which one is this? Kwashiorkor, and which one of the kwashiorkors is correct? Okay, why is this one incorrect?
Is it protein?
It's just protein for kwashiorkor. It's just protein deficiency. For marasmus, it's a across the board nutritional deficiency.
So why did the liver become fatty adjacent?
I don't know the patho. I'm not gonna try to make it up either, but I don't know.
That's just.
Which of the following is a finding of vitamin A deficiency? Oh my gosh, so easy. Neural tube, super easy. Okay. Which of the following is suggestive of thiamine deficiency? We said ataxia, that's the coat rack, right? Coat ataxia. Let's see. All right, this one, marasmus. You can see all the ribs. Very good. So we were talking as I was walking by about refeeding syndrome. So I'm not going to test you on refeeding syndrome, but we were talking about it. So that they first discovered refeeding syndrome during the Holocaust. So when the troops went to liberate the camps, they started giving these kids and people, not just kids, people food and a plethora of food. And of course they're starving. So they started eating and they saw that they were dying and they were trying to figure out like, why is people dying? And it's because of refeeding syndrome. So I'm not going to go into the patho, but I think I covered it in my lecture, a little bit about the patho and the phosphorus and stuff like that. Which BMI indicates a patient that is in class 1 obesity? Obesity, yes, 30 to 35. So for obesity and overweightness, I think it's hard to test. I want you to be familiar with the different BMI classifications for overweight versus obesity. I want you to know a little bit about the treatments, not necessarily like all the farm stuff, but like when do we treat diet modification, when is a person a candidate for surgery, that kind of stuff. Be familiar with it. It's hard to ask questions on obesity. I feel like it's something we all know a little bit about, at least familiar with it. But I haven't seen that many questions on QBanks on it, just being familiar with it. And they're also going to cover obesity again in endocrine. Okay. All right. Exclusively breastfed babies tend to be a little bit deficient in vitamin D because vitamin D is not excreted in breast milk. So that would probably be the answer here, vitamin D. I'm sorry, I'm reading fast. Heavy smoke. Okay, so this is an older man. He has struggles to get nutrition, adequate nutrition. He has petechiae, hyperkeratosis, swollen, bleeding gums, and he's malnourished. What did y'all think about this one? Vitamin C. And like, I guess we talked a lot about pirates and stuff, but it's a legit thing. I think I included an article in your presentation about vitamin C and how it's become more common in like the elderly population, especially institutionalized elderly populations, like nursing homes. They don't tend to get enough. So old men, they can get really bad hemorrhaging and things like that, and they can start losing their teeth. And vitamin C deficiency is one of the deficiencies that can come on very quickly. So if you're deficient for like a couple months, you can start showing signs of being deficient. Whereas like a B12 can take like 5 to 10 years before you start because you have so much store of it. So interesting. 2-week history, wounds on the side of her mouth, pale conjunctiva, tongue is magenta. Wow. Macerated lips, angular stomatitis, fussy eater, underweight. So there are several different vitamin deficiencies that can cause oral findings like stomatitis and glossitis and angular cheilitis. In this one, if you just look at the answer choices, you can rule the wrong ones out, and you know that riboflavin is the only one there that makes sense. That makes sense? Let's see, another breastfed baby. let's see, pigeon breast, depression of this, and string of beads. So this is different than the string of pearls that we saw on the small bowel obstruction. Basically what this is because you have so much osteopenia that where the bones connect in certain places, they look a little thicker. And so it looks like a string of beads where the ribs meet. And that is pretty easily rickets. And that was it. So did y'all see how that vitamin stuff is pretty easy? I think for your test, honestly, I think it's money in the bank. If you know the vitamins well enough, like that chart that I showed you, that's easily 2 or 3 questions on your test that you have right. So invest enough time in it that you're familiar, that you're not gonna be stuck between 2 answers and be like, crap, which one was it? You know it well enough that you'll get them right every time, because that's easily 3 points on your test.